Good morning, sir. My name is Ralph Christianarin and I am your nurse for today. May I ask for your full name and your date of birth?
Individual G. Agnes Vivaris, 2004.
Okay, sir. Let me check your tab. Okay, sir. And with me here is...
I am Justine Nicole Alain and I am here to insert your intravenous fluid.
By the way, sir, there is an order from the doctor to start an IV fluid to correct your fluid loss. Would that be okay, sir?
Okay.
By the way, sir, are you left-handed or right-handed?
Right-handed.
Okay, sir. So is it okay with you that we're gonna start your IV line in your left hand?
Okay.
Okay, sir. Thank you. So you place the IV fluids to the IV stand. So place the IV stand near to the patient's arm where you will start the IV line. Since we're starting on the left hand, you put the IV stand near to the patient's left side.
You hung the IV fluids.
Make sure that the tubings does not dangle on the floor. So you place the tubings near the insertion site so it would be easier for you to connect the tubings. Then you give gloves to the IV therapy nurse. And also, you also be wearing your clean gloves. This is to protect yourself from the body fluids or blood since you will be starting an IV. So once you are done wearing the gloves, the IV therapy nurse now will select a vein. So you have to prepare the tourniquet and you give it to the IV therapy nurse.
Sir, please make a fist.
Once you're ready to select a site, you disinfect the site with cotton balls with alcohol, from inner to outer. And make sure not to touch the cleaned area.
So after that, you give the IV therapy nurse the cannula. So you have to make sure that the sharp area should be facing you and be careful not to touch the cannula.
Then you have to get ready with your sharp container.
Once the IV therapy nurse has already hit the vein, you have to prepare your tubings and your tape. The first thing you have to do is to put the initial tape on the cannula. And at the same time, the IV therapy nurse will put pressure on this side to prevent blood from oozing into the hub area. Open the end port. Then you insert the cannula. Then after that, you remove the tourniquet. Then you put the tape here. And you also put tape to the other side. After that, you open the regulator. Do not fully open the regulator, just open the regulator a little bit to make sure that the IV line is patent or already hit the veins if it is already flowing. After opening the regulator, you make sure that the IV line is patent or the IV fluid is dripping. You have to secure the IV site completely. So, put a tape here like this. And you also put a tape here. Then afterwards, you have to regulate the IV flow according to the doctor's order. So if it is 30 drops per minute, you have to regulate 30 drops per minute. After the IV therapy nurse remove the sharp needle, you have to secure this sharp needle and place it in the sharp container, then drop. So you do not place the sharp needle anywhere to avoid needle prick. After that, you have to put the IV label and place it here. So it contains the name of the hospital, the name of the patient, the room number, the name of the IVF use, medication infused if there is any, the IVF rate, the date, the time, and the name and the signature of the nurse.
You have to put this in front of the IV bottle. This IV fluid serve as endorsement also for the succeeding nurse on duty that they have to note this IV fluid started on this date and time and then the rate.